one of the things that's been claimed in this case on behalf of Dr. Moranian and Dr. Moranian himself, I think, is that the lap band was the source of the infection that Ms. Martirosyan suffered. You're aware of that position that's been taken?
I am.
And did you give that some thought yourself?
Of course.
And what was your conclusion with respect to the claim that the lap band was the source of the infection?
The lap band was absolutely not the source of the infection.
Is there something that we could look at that would explain your conclusion in that regard?
Yes, let's go to the CAT scan. So this is a CAT scan that was done when Ms. Martirosyan came to the emergency room on the second hospitalization.
And while we're waiting for that to pop up on the screen, what's the difference between a CAT scan and an MRI?
So a CAT scan actually uses radiation to view things, where an MRI, there's no radiation whatsoever.
And and what do we get out of a CAT scan that we don't get from an X-ray?
You'll really be able to pinpoint any sources of infection. If there are any abnormalities going on in the abdominal cavity, you'll see them very vividly.
I will be able to finish with Dr. Cole before the break, Your Honor, if you'll.
Okay, I'm just standing up because it's an occupational thing. I do a lot of sitting, so I stand up occasionally. I hope I don't bother you. And the jurors are welcome to do the same thing if they need to.
And now you're, we're looking at images from a CT scan that was done. And this will be exhibit. Did you say 26? Well, we'll mark this as next in order, which would be 45.
Instead of 45, it did matter.
So,
all I want to know, Your Honor, is the date.
All right, what's the date?
this is November 18th, 2012 at 34 minutes after midnight. So it's the very early morning hours, shortly after Ms. Martirosyan was admitted, right, Doctor?
Correct.
So she's, while she was in the emergency room, they ordered a CT for her.
Correct.
All right. And tell us is there a particular image that is helpful in explaining your opinion on this?
Yes. So again, imagine that Ms. Martirosyan is lying on a CAT scan table, and essentially a CAT scan takes usually 1 centimeter slices starting from usually up on the chest and just sort of working its way down towards the toes. So this is one slice. Again, here would be the front, here's the back, here's the right side, and here's the left side. So again, we know, because you're all amateur anatomic experts now, we know that the right side is the liver. And this is the area that we call the gallbladder fossa. And you can see that there are tiny little bubbles in this area, as well as some debris, which is sort of ugly, not clean, again, very indicative of an abscess. And again, this area, or this abnormality, marks a lot of fluid that's in the abdominal cavity. And notice how that's really right over the liver, again, sort of in the area where the surgery took place. Now, again, there's this allegation that it was the lap band that was infected. So if we can then go up to the cut that shows the lap band. And again, a lap band is a device that goes around the end of the esophagus and onto the first part of the stomach to constrict the amount of food that someone intakes.
Now, this is actually, there's a number down here that indicates which image from there's a total of 173 images, and this is actually number 26 of 173. And the lap band that Ms. Martirosyan had put in 2007, is that correct?
Yes.
And so it was there, and it's something that, as a surgeon, you know that foreign objects inside somebody can be like a magnet for infection, right?
It can be if they're placed early on. In other words, so what I'm getting to is this was placed 5 years prior to her gallbladder issues. So usually when a device is put in, it's after a while the body tends to what we call epithelialize or cover the device and more or less incorporate it into its own tissues. So that tends to make it resistant to infections. So this is not the world's best image. But again, here's sort of the lap band device here. But notice that there are no air bubbles, there's no fluid, there's nothing that delineates that this is infected. And again, the official CAT scan report read by the radiologist stated that there was no signs of infection or abscess around the lap band. And we also know one final thing.